thank you for being here and for your commitment to our wonderful, truly amazing university. And with that, let me turn things over to Christy Wyskiel, Senior Advisor and Leader of Johns Hopkins Technology Ventures. Christy is someone who has a wonderful and very storied past in working within the innovation industry. Several years ago, Christy came to see me to tell me, at that time she was not affiliated with the university. At that time, she told me in very stern and earnest terms all the things that were wrong with the way in which Johns Hopkins was supporting or not supporting innovation activity. And I should say, at the core of her criticism was the role of lawyers. I am trained as a legal academic, and so she hit me very directly between the eyes on this issue. And the only thing I could think to do at the end of our meeting was to hire and say, okay, now you fix it, and fix it she has. So it's my great pleasure to welcome Christy Wyskiel to the stage.
Thank you, Ron. That's a true story. Good evening, everyone. It's great to be in the Bay Area where I always have a sense that anything is possible, and no matter how big the idea, it can be made into a reality. I'm excited to share with you tonight how we're trying to replicate a little bit of that magic at Johns Hopkins. Before I get to that, let me echo Tony and Ron's comments. I want to thank each of you for supporting our students and our faculty, for introducing Johns Hopkins to potential new donors for our programs, potential new investors for our technologies, and potential new mentors for our up-and-coming entrepreneurs and our startups. In a moment, you'll hear from one of these students on our panel, Neil Renz, as he talks about his experiences as a team of undergraduates on a company called Azon Health, doing some pretty cool things. But first, let's take a moment to meet another student who is doing great things with her Hopkins undergraduate education and exemplifies the kind of entrepreneurial talent currently found in all corners of the university.
In the recent outbreak of Ebola, there have been over 28,000 cases, resulting in over 11,000 deaths. This was what everybody was reading on the news. But what excites me most about biomedical engineering is being able to help people with the skills that I possess. So when I learned about the Ebola Design Challenge, I immediately signed up that night.
So the number one reason for this design challenge was this notion that you have the bravest, the most passionate, the most selfless people in West Africa taking care of Ebola patients. And they are there with suboptimal gear. And many of them are losing their lives in the process of doing that. So we decided early on to make this an all Hopkins, all hands on deck design challenge.
What the challenge was to deal with PPE, which is personal protective equipment for Ebola workers.
And we started to subdivide the problem into some discrete topics, like visibility of the healthcare worker, removing the garment carefully, more fluidly, and then comfort. In fact, Gabby worked on that team that focused on the thermal cooling of the suit.
In the areas where there were outbreaks in Africa, a lot of times the humidity could reach up to 100% and temperatures were 100 to 115 degrees. So they had to don and doff, which is the taking on and off of the Ebola PPE, every hour or less to not get heat stroke. So this becomes very dangerous when you have this virus on the outside of the suit. So my group decided to focus on the cooling and the venting to increase the amount of time that the caretaker can stay in the PPE. Materials which are air permeable and now the current suit has multiple vent systems, especially in the face mask. And the top two vent systems allow the user to breathe in air, and the bottom one allows the user to exhale out air.
We also now have double the amount of filter fabric.
So undergraduates bring an amazing world of fresh perspectives, just raw creativity and intellect to these challenges. And I think Johns Hopkins is a place where you bring these amazing students together with amazing experts, and then you get something totally new. And together with Johns Hopkins Technology Ventures, we were able to get a licensing deal done with DuPont for the Ebola suit. And we expect product in the market in record speed. And when people wear that product, they're going to be safer and they're going to be more comfortable and they're going to do their job better. So the work that Gabby did, the work that other undergraduates did, other students did in that design challenge is going to save lives.
And having these sorts of opportunities, like getting the Kenneth Edwin Shaw Scholarship, is making a big difference in my life. So I think it's really important to give back wherever you are in your life. And I'm currently a teacher at the community school at Remington. The fact that the clinicians and sponsors and all the professors really trusted me to actually partake in the Ebola challenge and have an opinion on it was really important to me. Although I was contributing such a little portion to a huge team, the experience definitely gave me a lot of confidence in terms of applying my knowledge to something that I haven't done before. And it allows people to go into the future knowing that they can make an impact in the world.
Wow, I find myself constantly in awe of talented students across this university and the impact that they're already making in this world. And I think you'll agree with me. It's important to continue to fund more endowed scholarships and fellowships to make a Hopkins education accessible to phenomenal undergraduate and graduate students like Gabby. One of the great pleasures in my role as the head of Johns Hopkins Technology Ventures is the opportunity to meet students and see an amazing array of faculty and students at all stages of their education and careers working on these innovations. And I feel so fortunate to be leading this team under the guidance of President Daniels and business leaders like Tony Coles to build this innovation ecosystem and a more robust set of resources to support our student and faculty involvement and endeavors and develop new sources of revenue for Johns Hopkins and a stronger economic future for Baltimore. Our inspiration is the kind of entrepreneurial risk-taking you experience every day here in the Bay Area. And if you'll indulge me for a moment, I'd love to tell you a little bit more about how we're doing this. The role of technology ventures, in my opinion, is to create as fertile a soil as possible so that the many seeds of innovation that fall can have the ability to grow across Johns Hopkins. We have several business units to support this: the Classic Technology Transfer Function, Fast Forward, our home for startups, and our corporate partnership group, which recently inked a multi-year collaboration with MedImmune that includes a joint PhD program that President Daniels has talked about. When I first came on board, I was lucky to work with a number of very entrepreneurial faculty and students that went around the country and looked at vibrant ecosystems, those like alum June Lee has really put in place at UCSF and others, and to say, what is working? We took a strong look and mapped our own ecosystem and said, what is it about those ecosystems and what is it that we need? And we realized that all strong ecosystems, particularly around universities, have three things in common: space, resources, and funding. And by space, I mean affordable, flexible space, in our case, often lab space that is needed for entrepreneurs to start their companies. By services, I'm talking about boot camps, mentorship, accounting resources, legal resources, other things that people need as they think about starting a company. And by funding, various types of funding, not just institutional funding that we might think of for an institutional stage company, but early grant stage, ability to do prototyping, and I think you'll hear a bit more about that from some of our entrepreneurs in a moment. So what have we done so far? A lot, but thanks to the work supported by our alumni, parents, and friends like you. We have 2 spaces that we offer for entrepreneurs: Fast Forward Homewood near our Homewood campus, and a Fast Forward location in East Baltimore. We'll also be rapidly expanding in East Baltimore, adding another 25,000 square feet by the end of the year of both flexible lab and office space for our startups. We have been fortunate to receive philanthropic support to create the spaces, but demand exceeds supply, and we need to continue to build out these spaces. Before we had space, companies like Cardioxel, which you'll hear about from John Toscano on our panel, actually moved away from Baltimore and started and grew the company there. But now, John can build his company right near campus. And I hope that next time you visit us, that you'll come see these thriving hubs and meet some of our companies. Our startups and entrepreneurs need a variety of services and resources to support them, and our spaces will be places where we can run programs like I-Corps, our boot camps, our legal office hours, our accelerator programs, and our speaker series. We've also put resources in place, including mentor and residence programs that pairs very successful entrepreneurs and titans of industry with our faculty and students who want to understand how to build companies. We also provide a 6-month program that President Daniels mentioned called the Social Innovation Lab that nurtures the development of nonprofits and mission-driven for-profits. In fact, we just had our Impact Day, where each of those companies that went through this last cycle were able to present their idea in a pitch session to a room very much like this to local foundations who really want to support those ongoing projects. And for those of you who are students or future students, I want to make sure that you know that we are definitely focused on supporting student entrepreneurs. Thanks to the generosity of Hopkins alum Ralph O'Connor, we now have a full-time staffer who works exclusively with student teams. And this year alone with our Student Venture Coordinator is working with more than 130 students from across Johns Hopkins, which brings me to the last leg of our stool, funding. We now have seed funding available for students thanks to the Ralph O'Connor gift, and later you'll hear from Neil about his team Azon, one of the first recipients of this student funding. We also have a translational seed grant given by a generous trustee, Louis Thalheimer, helping our teams move beyond the valley of death by supporting proof of concept, prototype, and feasibility studies. All of this work we have done to build the ecosystems, trying to help our entrepreneurs with the work that are doing. And we're always looking for more mentors, more donors, more partners, and for those to come forward and help our startups, our faculty, and our students. I could go on and on about this, but I think it's more important and valuable for you to hear directly from some of our student and faculty entrepreneurs. So I want to begin the conversation. They're going to briefly describe their work. Their bios are in front of you, so you can read a little bit more about each of these four. But Sharon, let's start with you. Tell us a little bit about some of your projects.
Hello, everyone. I'm Sharon. I work at the Whiting School of Engineering, and I'm part of the Institute for Nanobiotechnology, INBT. The Institute for Nanobiotechnology is interfacing engineering with life sciences and medicine to develop new tools and approaches to understand biological processes, but also to develop new diagnostic and treatments. Throughout the years, it's the 10th year now of the Institute. The Institute is doing great in research and in training of students, but we also established a partnership with cooperation where we encourage or try to foster faculty to do more translational research through a project with industry, sponsor research, as well as offering internship for students. Specifically in my lab, we work to apply fundamentals of engineering to study regenerative and cancer processes. Specifically, we focus on blood vessels that are important for both of these aspects. Throughout the years, we develop ways to guide stem cells to make blood vessels, develop different biomaterials to induce blood vessels. And at some point, we had this nice body of work and portfolio of patents, and we really wanted to make an impact. And with the help of JHTV, actually, they introduced us to investors that liked what we had to offer. And we, through JHTV, we actually negotiated the creation of Gemstone Biotherapeutics. Gemstone later on received or rented an office space in this Fast Forward next to Hamoud, and recently a new lab space in the Fast Forward East. And this is great and affordable. In parallel, in the lab, we continue and develop new technologies, and with internal seed funding within Hopkins, we're able to do research that is not necessarily fundable by government and foundation, and allow us to do to have new discoveries that otherwise we wouldn't have succeeded to do that. So I'm actually looking forward to the next company or companies and working with JHTV to make it happen.
Hi, I'm Isaac Kinde with PapGene. The term cancer actually represents many different diseases, but what's common to all of them is that patients usually die when they're diagnosed with late-stage disease, and that patients usually live when they're diagnosed with early stage disease. Today, we don't do a good enough job finding early stage cancers because we don't have reliable tests to find them. At PapGene, we're developing next generation cancer tests that will address this important but yet unmet need. The technology that we're commercializing was actually developed at Hopkins, and I'm actually a co-inventor of the technology because I was able to help develop it while I was a graduate student in the lab of Bert Vogelstein and Ken Kinsler. Our focus now is to develop a test for ovarian cancer, and through Fast Forward, Hopkins Tech Ventures has been supporting and accelerating our test development efforts. A key example is our laboratory facilities. We're very grateful for Fast Forward for giving us a custom designed laboratory that met our specific needs, which wasn't cheap. And besides directly benefiting from using the laboratory for our test development efforts, it's also been considered an asset when we were doing fundraising, including closing $3 million Series A round investment last year and winning a $2.3 million grant from the National Institutes of Health earlier this year. Besides the facilities, we've also benefited from Fast Forward's many programs that are geared towards startups, including receiving discounted legal services and having the opportunity to meet with experienced industry veterans through the Mentors in Residence program. So overall, we're very appreciative of Hopkins Tech Ventures, and ultimately all of the help that they've given us gives us the opportunity to spend more time tackling the problems that we're most excited to solve.
Good evening. My name is Neil Renz, and I'm a senior studying biomedical engineering, and I'm a team member of AZON. So for the admitted students out there, I have one really important tip for you, and that is to read the daily announcements, because that is how I got involved with AZON. It was during my freshman year, just a few months in, and there was an open meeting for anyone who's interested in joining a team to build a device that patients can use to diagnose themselves. And being a curious and naive and ambitious freshman, I showed up along with a number of other people. And today, 3.5 years later, we're the only undergraduate team that is a finalist in a $10 million international competition. And thank you. But that hasn't happened in a vacuum. In reality, I think it could only have happened at Hopkins, and in fact, it did only happen at Hopkins. We received mentorship from people throughout the entire Hopkins community, from Yosef Yossi, who you saw in the video at the Center for Bioengineering, Innovation, and Design, to Alan Lebreek at the School of Public Health. Even through Tech Ventures, we were put in touch with an alumnus, Dr. Ken Zonis. He's a physician, and aside from the undergraduates who are team members, he's probably the most integral team member. He's provided just outstanding insights to us. And so it's really this broader community and then other resources that we've acquired through Tech Ventures that have allowed us to achieve what we have. We were, as Christy mentioned, one of the first recipients of the O'Connor Fund, of an O'Connor grant. And that enabled us to continue rapid prototyping with 3D printing. It allowed us to consult with expert designers. It allowed us to cover some of our legal barriers that we had to overcome in order to stay in the competition. We were also part of the Social Innovation Lab, where we got to meet other students who had incredible ideas. One, Urban Pastoral, is doing hydroponics and urban farming in Baltimore. And so meeting these people and seeing the ingenuity and the passion of fellow students and understanding how they're going about their problems, and then receiving other forms of support through the Social Innovation Lab, like legal office hours, like project management advice. These were all just absolutely necessary for us to get to where we are today. And so where we are today is we're in the finalist round, and 2 months from now, we'll submit our devices to the X Prize Foundation for testing with consumers. And in January 2017, they'll announce the winners. So stay tuned.
Hi, my name is John Toscano, and I had the incredibly good fortune to join Johns Hopkins University 21 years ago as a professor in the Department of Chemistry. And about 10 years ago, together with collaborators from the Division of Cardiology in the School of Medicine, we founded a startup company called Cardioxyl Pharmaceuticals, whose goal was to develop new novel drugs for the treatment of heart failure. So heart failure is the #1 cause of death in the world today, and also the leading killer in the United States. I think on the order of close to 400,000 deaths per year attributed to heart disease. And so Cardioxyl's approach was based on chemistry developed by graduate students and undergraduate researchers in my laboratory, and independently physiology developed in the School of Medicine. And so this was, as we like to say, a true one university initiative, an effort that couldn't have been successful without both of our contributions. And I also think this is one of the great things about being at a place like Hopkins, where the breadth and quality of research going on throughout the university allows such collaborations to be so effective. So we developed a new class of compounds that was effective in treating heart failure by a very unique mechanism, a mechanism that we continue to study in our labs today. And Cardioxyl initiated phase 1 clinical trials that represented the first in human testing of this new class of compounds. It's been a long and very interesting road, but progress continued to be made. And just this past December, Cardioxyl was acquired by Bristol Myers Squibb, who is going to take our lead development candidate into phase 2B clinical trials. So obviously very exciting, and we're very hopeful that this new drug will have a real and positive impact on human health. So when we started Cardioxyl 10 years ago, the JHU Tech Transfer Office was very different, to be honest, than what it is today under Christy's leadership. And to be perfectly honest, beyond even the space issues that Christy mentioned, I would say that we really didn't have the support that was really necessary from a business development point of view. In a lot of ways, we got very lucky. So for example, a former Hopkins cardiology postdoctoral fellow who had previously been involved in a cardiovascular startup company that was successful had heard about our new technology and approached us about joining the team with another business partner. And they did, and it was really this business focus, I think, that was an additional key to our success. And so I think it's really important to realize that the new business resources and expertise that's now available through JHTV under Christy is going to have an incredibly beneficial impact on new JHU startup companies going forward. Nothing is going to be left to chance, and that's obviously a very welcome change. And so I think I can tell you from firsthand experience, and I think what you've learned from my fellow panelists here, I hope, is that I think that the tech transfer culture at Hopkins truly is changing, and I think this is tremendous news for our faculty, our students, and the university as a whole. And I'm very confident that there's going to be even more success stories coming out of JHTV in the near future, and I know that's something we're all looking forward to.
Thank you. Great. Well, our goal is to make this as interactive as possible. We have a wonderful group of folks in front of you and would love to entertain questions. We also have a number of people online who are able to submit questions, but what can we answer for you? Yes, right here. There's a mic coming. Here you go.
Hi. Do you ever include people from the humanities in some of these teams, since creativity is often viewed as being fostered by divergent thinking?
Thank you. I hope that question was a plant from Dean Wenland right here. I hope. Thank you. I know she appreciates that. John, would you like to
Yeah, absolutely. I think, research, there's a very broad aspect of research, and as you say, bringing diversity into research is really important. And so we like to have research opportunities for all of our undergraduates, whatever their interests are, on the science side, on the engineering side, and also on the humanities side. And so we're working to provide those research opportunities, and I think one of Dean Wendland's goals is to have every Johns Hopkins University undergraduate involved in independent research in one form or another during their time at Hopkins, and I think we're making great strides towards that goal.
Yeah, and just to jump in on that, on our team of 20, we have multiple biophysics majors, and we also have worked with a couple of writing seminars majors who have helped us in making videos, and that really improves our user experience, helping the patients just put on the system. It really helps having these videos, and for us, it's really been instrumental to have diversity on our team.
Great. What else? Right here? Yeah. Oh, sorry, here.
I'm going to ask another Bay Area type question. I volunteer to do interviews with the admissions department. I've interviewed 13 candidates for undergraduate school in the last 3 years. Not from one of the students, but from one of the parents, I heard that Forbes magazine has ranked Hopkins lower than U.S. News and World Report did, and is because of earnings 5 years after graduation. I assume that has something to do with the fact that the students are a little different in that they stay in Baltimore and have a different focus. And I was wondering if you've thought about turning lemons into lemonade, perhaps by saying we are different and we have a different focus. I hear that as a theme, but could you comment on that, because it relates to how I talk to students who are applying to the university.
So, imagine, for all the issues about rankings and what are the right rankings and whether rankings mean something or they don't, we can have these endless debates about that. But the U.S. News and World Report did rank us in the top 10 this past year. But I think, of all the things that you would use to evaluate the quality of a program, to think that earnings within 5 years of being at a university, that should be the essential measure of performance of an institution, it's kind of preposterous. And, particularly in a setting where the lion's share of our students are going to go on to do things in professional doctoral programs and so forth. So, this is one where though we want to provide pathways to a whole host of different careers and opportunities for our students, it's so important, I think, that we really resist that kind of very simplistic commodification of the degree that, 3 years out, that determines the quality of the program. The thing that I hear time and time from our alumni, when they speak of the essence of the Hopkins experience, they said, I had no idea how well this degree would serve me for something that I had to contend with 25 years later. But it was the sense of judgment, the way in which I was able to discern and evaluate complex set of issues. These were attributes, these were instincts, these were competencies that were really honed at Hopkins. So again, this is where I just bristle as an educator, thinking that, that should really get pride of place. But if anyone wants to add that to that, I'll go back to my seat.
Thank you, Ryan. Yes, sir.
Thank you. Just want to thank the panelists. Great sharing. My question is about return on investments, and I'm sure that you've thought about this, and that we pour a lot of investments into these endeavors, and the return on investment. What proportion, let's say, of the return on investment would you consider to be what proportion of the endowments, let's say, would come from such investments? Others might, like a pharmaceutical company, picking up, and that's needed. A bigger company that might bring it to clinical 2 trials.
Right.
But at the same time, we're giving away something that you have already developed, all of you have developed. And so, you know what I'm saying, I guess, in terms of return, and how do you calculate the proportion of that? Because after a while, the weariness of donors, and after a while, it's great we have philanthropists who are there, but I'm looking more at this innovation that you've introduced as actually making our school sustainable in the long run, so that if a greater proportion of the funding of the school in all its endeavors come not just from philanthropists, which is good in itself, but also from the return on investments of what you all have been greatly doing and contributing in service of others. I think that would make it a lot more, our funding more sustainable. Thank you.
Great. No, thank you for the question. I think one of the ways that we look at it, when we in particular consider that we have been the #1 NIH-funded institution for 35 years in a row. Yes, that definitely deserves applause. One of the things we look at is how effective and efficient have we been at taking those NIH dollars and producing some sort of revenue-generating products or activity from those. And when we studied this 2.5 years ago, we were towards the bottom of the rankings in terms of licensing revenue from those activities. And so directly applicable to this panel, I can't speak for necessarily the rest of the university, but certainly when it comes to the innovation activities, I would say that our goal is absolutely over time to generate revenue that will not only sustain this activity, but that we can pour back into the research of the institution. If you look at our peers, there are often 1 or 2 very large hits that result in tens of millions or even hundreds of millions of dollars coming back to the institutions, one big drug. In the case of University of Florida, it was Gatorade. Stanford had Google. There are a number of examples where there were very large wins, so to speak. We have number of shots on goal. Last year alone, we had over 500 invention disclosures come into our office. That's top 5 in the world as far as activity. And so I have a lot of confidence that we have many shots on goal. We just need to progress those. And ultimately, yes, I believe particularly for the innovation activity, it absolutely can be self-sustaining. Back here.
Thank you very much. I applaud the collaborative spirit of Hopkins. My wife, as a former researcher and med school graduate, speaks no more highly of Hopkins than any other place in the world. But a question, I've seen a lot of universities, particularly in the undergraduate space, promoting an entrepreneurial program, whether it's tech ventures or some equivalent thereof. And there have been some critics, and I don't want to overemphasize that word, but some critics who have said that perhaps it shortchanges the undergraduate experience by pushing or promoting or encouraging, the pathway of developing their career goals maybe a bit too prematurely. Do they miss some of that experience of liberal arts or, of science exploration by, channeling them too quickly? I don't have an opinion, but I'd be curious what yours is.
Sure, and I'm going to let Neil answer, but I think from our perspective, what we want to do is provide and be available for those students who choose to engage in the activity. It's not a force-feeding mechanism, it's just an availability. So for those that need the space or want the opportunity to participate with the teams or want to reach out and apply for those types of funding, it's available, but in no way mandated. Neil, do you?
Yeah, I think building on that, that's exactly what my experience has been, especially one example of this for me is the Social Innovation Lab. Before entering that cohort, Azon, the members of the team, we didn't know all the other entrepreneurial activity that was even happening on campus just because other undergraduates are so focused on other exciting opportunities like research or club sports and varsity sports or all the other clubs that are on campus. And so one of the things that was exciting for me was meeting these other fellow undergraduate entrepreneurs. And so it definitely was not, I didn't feel like it was forced on me in any way. And even more than that, I'll be going to medical school. And so my path, while it was certainly influenced, and I hope to stay involved in med tech entrepreneurship, I was not forced in any way to stay with that. I was encouraged to pursue my other goals as well.
Great. Yeah, June.
Christy, but first of all, congratulations on all the progress you and the whole team have been making. It's really amazing what you're doing. In terms of, it sounds like a lot is happening. It sounds like a lot of the students and lots of faculty are really embracing of all the different things that are going on and the focus on entrepreneurship and innovation. And for institutions like Hopkins, UCSF included, that take a lot of public funding by way of NIH. To do our research, I mean, it really is part of our public mission to actually figure out a way to have that impact back to the people. So I think what you're doing is really, really needed, and it's essential, and I think it's really part of our responsibility. But I'm wondering if you are finding any pockets of resistance, and are there people who, as the gentleman back there asked about students, are there faculty where this emphasis appears to be one that they're not really so embracing of? And if so, then how are you sort of working with that group of folks?
John, do you want to?
So I can say that I don't think we've seen a lot of that, especially with, certainly our junior faculty are very motivated in this way. And maybe you might have some senior faculty that sort of set in their ways and think that we're an academic institution and we should focus on academic issues. And if we go way back to the first chemistry professor at Hopkins, Ira Remsen, who was involved in discovering saccharin, he wanted nothing to do with commercializing it, right? So I think we've come a long way since then, and I think we're going to continue to go.
Sharon, do you want to add to that?
I just want to add that, well, I'm in the engineering school, so I think we see much less of resistance, if at all. But I think it's a good discussion to have, and it's, it's ongoing, and it should take place, and, wherever it's going to end up, that's great, but definitely not ignore it.
Okay. Yes, over here.
Hey, thanks for taking the time. I'm really curious. I think Hopkins has demonstrated prowess in a lot of academic research and medical innovation. Would be really curious to get your perspective on like the diversity of innovation, right? Especially being in San Francisco where consumer tech and internet have really quite blossomed. Would be really great to learn more about opportunities that Hopkins Tech Ventures, and not only on the funding side and the mentorship side, but then on the academic side as well for undergrads. How are we doing in inspiring students to take risks and build businesses and try out new ideas? I think that's where schools like Stanford and local favorites have done a really good job, and would be cool to get your perspective on that as well.
Yeah, thank you. So Beverly can keep me honest on the numbers here, as can John and Larry and others that are here from the schools. But it's my understanding that over 1,000 students each year participate in our CLE, so it's our entrepreneurship education program on the Homewood campus, and that is becoming an increasingly popular avenue of study. And some of the capstone projects in our entrepreneurship courses do involve, in fact, one of our most recent applicants and recipients of the O'Connor funding was simply a student project in entrepreneurship that was actually modeling. It was very, very clever. It was modeling a better way to sign up for classes from colleges, because that's apparently the bane of a lot of people's existence, figuring out. Of course, in my day, you actually had to go stand in line. But anyway, this is before the internet. So I think there is, on the academic side, an increased interest. As far as really the IT space, when you look at our disclosures, our companies, really any of the metrics, about 3/4 of what we're seeing flow through in company creation and patenting is in the life sciences. But the other 25%, which is a very large number when you consider the whole, is coming from other areas, including IT and various aspects of that, cybersecurity, robotics, a number of the very hot areas. So, I think we have a lot of that research going on, and we don't have a flagship IT company yet, but I'm hopeful. Yeah. Wait. Sorry. Someone over here. Yeah. Mm-hmm.
Hi. Yeah. Thank you very much. I really enjoyed hearing all the stories from the panelists. And it sounds like a lot of the programs have been really successful over the past 5 years, and the innovation ecosystem is much improved in supporting a lot of the ventures. But I'd be interested in hearing, is there anything that is actually still lacking in the ecosystem, or Or maybe phrased a little bit differently, when you look at the next 5 years and the challenges that still face you, what do you see on the horizon?
Great. I'm going to turn it to the panelists, but I was just having a conversation with President Daniels where he described where we were as the end of the beginning. And so the big picture answer to your question is yes, I think there are many more things. Would you all like to take a shot at, Isaac, you want to start?
Sure. There's a few big problems, big challenges that our company is facing in the next 5 years and even sooner, and that is the result of our tests have serious consequences. And so one example is for ovarian cancer, one of the reasons why there aren't screening tests widely available or recommended is that you get a result, and to follow up on that result, you have to actually take the ovary out and look at it. So it's a very serious, there's very serious implications for the types of tests that we're developing. And understandably and justifiably so, there's a lot of regulatory hurdles that we have to face. And not only do we have to address regulation, but we also have to address actually getting reimbursed, getting paid for the tests that we produce. So we have to get the government on board, we have to get insurance companies on board. So it's definitely a challenge, but it's something that's, well, at least we believe, very worthwhile pursuing. And we're optimistic that with the team that we have assembled and with the support that we have from Hopkins and the foundation that we have, that will ultimately be successful.
Anybody else on additional resources, Sharon?
So I think what I see is a challenge is maintaining things in Baltimore for long term. I can tell you that the investors in the company that came out of my lab are very passionate about leaving things or promoting things in Baltimore. Two of the three employees in the company are graduates from my lab. They worked in the lab for a little bit as the company was forming, and that cultivate a culture, and other students see that you can actually have a product from what you work in the lab. So it's very important. I think that's a challenge that we are facing, and I'm sure it will come to the company as it grows, if there is a place for it to stay in Baltimore, and I hope it does.
Okay, back here.
It can be difficult to incentivize young faculty to focus on things like generating patents or being entrepreneurial when all of their metrics for success as they relate to tenure and promotion are tied to bringing in grant money or publications. What are you doing to address that?
Sure. So, and Sharon and I were just having this conversation, so I'm going to let her answer it. But I can tell you that our Vice Provost for Research, Denis Wirtz, who spent a lot of time in the Institute for Nanobiotechnology, a very prolific researcher, has been collaborating across the university to ask this question and try to get it answered. Sharon, do you want to?
So I can comment on the engineering school that with the new dean. There is an effort to have a research education and translation as the third wheel. It's of course is a change in making, a discussion with the faculty, but it is coming from actually younger faculty that come in with patents, with experience, and then they're wanting actually to do this commercialization and all of that. It's happening. It's not a one-day change. Hopefully it will work out.
John, do you want to add?
Yeah, sure. So in the sciences, it may be a little bit different because I think the sort of things that you would do to sort of go down a patent pathway, prior to that, you need to generate the data, and basically you can just set up a patent application before the paper is published. So it's a matter of just getting that step in, sort of in between the paper being published, for example, so that you have coverage to potentially take advantage of that technology going forward. And so part of what we're doing with Christy's help is trying to educate our faculty that this is really not anything more than what you're already doing. It's just something extra that potentially could be beneficial down the road, because it may be something that you're not even thinking about, an actual application or a commercial or a startup company, but it could be applied down the road. So I think, you know, that it's all sort of part of the process.
Great. Yes, right here.
Christy, this question is from an online viewer.
Okay.
Who is asking, how do you think tech ventures can have a meaningful economic impact on Baltimore, and what partnerships would make that more likely?
Great, thanks so much for the question. So we took a look, and it took us quite a while to gather this data. Those of you that are in economic development can appreciate this. Since 2010, companies that were founded based on Johns Hopkins technology have raised over $1 billion in capital. So we know that there is real money, smart money, going to support our companies. But more than 90% of that capital left Baltimore. So 10% of our companies and that capital are staying. And so I think one of the things we're really trying to address is why did that happen, and how can we build that ecosystem? And I think it really does come back to the three principles I've discussed: the space, the resources, and the funding. Companies like Cardioxyl, there were no space options. There was another company called Amplimune that wanted to stay in Baltimore. There were no space options in Baltimore. They ended up going to towards the DC region. And so I think if we continue to methodically put in place options so that Gemstone and companies like Papgene can stay in Baltimore, bring those resources to bear, form teams, get the talent, I think that's really where the ecosystem building comes in. And finally, I think we have a number of corporate partners very interested in investing in coming to town. We already have major partnerships announced with, as President Daniels mentioned, with MedImmune and with Bayer, and in coming weeks you'll see a number of other large partnerships announced with so I think there is increased interest in the ecosystem of Baltimore and seeing what we can do, but we do have to have a strategy and be thoughtful about what that is. Anything else? Yes, right here. Looking into the light, but I see a question.
So the business school, Johns Hopkins Carey Business School, has this course called Discovery to Market, which especially looks at commercializing novel technologies in the nascent state, which are in the nascent state. How much of a collaboration do you have with this program in the business school, and how has it been? Has it been fruitful, or how would you assess that?
Yes, no, thanks so much for that question. So we actually work very closely with Phil Fan and Nayang Louie, who run that course. And we supply the technologies that the student teams evaluate over the course of the year. And that includes detailed market analysis, customer discovery, really an understanding both technically and from a financial perspective what would be required to bring that technology market. And I can think of several examples of products that have been licensed and moved into companies that were part of that process. I think both the business students and the faculty and students that are inventors both benefit heavily from that, and that out of that course actually spawned the Entrepreneurship Bootcamp that President Daniels supports and really championed, so that folks who wanted to dive even deeper from those type of products. So we're very grateful for Carey and their activity. So maybe time for one more question. Yes, right here.
Thank you for sharing your experiences. I think as alumni, we have a wide breadth of experience to share with these students. How can we better leverage ourselves or be more involved in the ecosystem?
Thank you so much for asking. I have such a strong belief that our alumni are our best mentors. And I think if you look at our mentor in residence program, for example, it's heavily dominated by the alumni community that want to give back. You can get directly in touch with me on our Tech Ventures website. We actually have a place where you can apply to be one of our mentors, but I encourage you to reach out to me. I think that the more folks like you, and that was not a plant, by the way, but I'm so glad she asked the question, because we really do need more people involved, and particularly those that work at investment firms, those that work at companies, those that really have an understanding of what it takes to bring a product to market. We're so grateful for folks working with us, so please do reach out directly. So, yeah.
Well, thank you, Christy, Sharon, Isaac, Neil, and Janet. That was terrific.